My name is Dr. Fleming Mathew, and I'm currently working as a resident medical officer in a multi-specialty clinic here and tertiary care medical center in Uttar Pradesh. I am also like a teaching assistant one at Harvard School of Public Health. It's a school. It's like one of the top most programs in the United States of America, which teaches about evidence-based medicine and public health. So today, we are going to talk about the various clinical modalities, the diagnosis, the etiology, treatment, prevention, and diagnosis of hypertension. I think why this is very important is because I think if you have read the flyer, it said that you are seeing increasing cases of hypertension being diagnosed in the young. And when I say young, it is usually a population with the age group of between 20 till 40. And this was not the case, I think, like 30 to 40 years before. This is something that we are starting to see like recent. तो हमारी जो चर्चा है मैं कोशिश करूंगा कि मैं हिंदी में बात करूं एंड देन आई कैन स्विच टू इंग्लिश एज वेल ऑल्सो खूब सारी स्लाइड्स हैं इस प्रेजेंटेशन के अंदर एंड अगर आपको बीच में किसी में भी कोई डाउट होता है देन प्लीज शेयर कीजिएगा आप चैट में आप लिख सकते हैं एंड चैट में आप सवाल पूछ सकते हैं एंड आई कैन एड्रेस योर क्वेश्चन राइट सो आई एम गोइंग टू शेयर माय स्क्रीन नाउ ओके So I hope you can see my screen at the moment. Yeah, perfect. So the heading today is hypertension in the young adult, and हम जब बात करेंगे सबसे पहले जैसे मैंने आपको इंट्रोड्यूस कर दिया मेरा नाम डॉक्टर फ्लेमिंग मैथ्यू है मैं currently president medical officer and together with that I'm also teaching assistant at Harvard School of Public Health. मेरी रुचि शुरू से well एक सर्जन बनने में थी बट मेडिकल स्कूल के अंदर मैंने नोटिस किया कि practicing evidence based medicine, to be a scientist, to do research, to come up with new clinical and treatment modalities to treat a specific disease is something that interests me. एंड अगर हम रिसर्च में अगर अपने एनर्जी को इन्वेस्ट नहीं करेंगे देन वी कैन नॉट कम अप विद बेटर ट्रीटमेंट एंड इट कैन बी समथिंग एज स्मॉल एज providing a new treatment for hypertension which is like cost effective when compared to अगर 5 rupees भी सस्ता है अगर existing treatments then it is something that we should look forward to especially in a country like India. So इस डिस्कशन के अंदर वेबिनार के अंदर इन टॉपिक्स को हम एड्रेस करेंगे. So आप जब देखेंगे स्क्रीन पे there will be like 5 topics here. सबसे पहला है we'll discuss about the definition of hypertension and the epidemiology. Epidemiology का मतलब ये होता है कि something that relates to the public health, something that we can talk about with respect to the public. अगर हम इंडिया की बात करें which is like a 133 crore strong population, we will look at how many percentage of the Indian population is suffering from hypertension and what are we really doing about it, what the real state is about hypertension in India. Second जो है हम बात करेंगे etiology and the risk factors. Etiology थोड़ा सा भारी word है but etiology का मतलब ये है कि what are the causes of hypertension. उसके साथ ही risk factors क्या है. I mean, if you know about the risk factors, you could be cognizant about it, और आप कोशिश कर सकते हैं कि आप इनको avoid कीजिए. तो हम बात कर रहे थे the third जो हम बात करेंगे जिस चीज के बारे में that is the signs and symptoms. Fourth, we are going to talk about the diagnosis and the complications of hypertension. हम कैसे diagnose करेंगे hypertension को और hypertension अगर एक बार हो जाता है तो उसके क्या क्या complications होते हैं. Fifth हम बात करेंगे treatment पे and then sixth हम बात करेंगे prevention पे. तो epidemiology पे आते हैं. What is the public health scenario of hypertension in India? तो जब इंडियन पॉपुलेशन आप देखेंगे उसमें majority of the population it lives in rural India and then some population lives in urban India. 33% of the urban population in India is suffering from hypertension. 133 करोड़ की आबादी के अंदर 1/3 is suffering from hypertension. 25% of the rural population it is suffering from hypertension as well. जब हमने स्टडी करी है नेशनल सर्वे के थ्रू हमने ये पाया कि of the 1/3 people who have hypertension, only 40% are getting the treatment for it. So more than 50% are not even getting treatment for it. And in the rural areas, it's 25%. अगर आप हम हमारा टॉपिक आज का है हाइपरटेंशन इन द यंग, एंड हमारी जो पॉपुलेशन है, आबादी है, इट्स 1.3 बिलियन और 133 करोड़। एंड आपने सुना होगा कि इंडियन पॉपुलेशन को द यंग पॉपुलेशन कहते हैं, एंड इट्स बिकॉज दैट 32% ऑफ द होल पॉपुलेशन इट इज इट इज कंपोज ऑफ यंग एडल्ट्स, दैट इज फ्रॉम द एज ग्रुप ऑफ 20 till 39 years of age. एंड यंग एडल्ट्स के अंदर देखा जाता है कि 7% ऑफ द यंग एडल्ट्स आर सफरिंग फ्रॉम हाइपरटेंशन एट द मोमेंट. Now 7% may not sound like a lot, but the problem is 7% of 133 crore comes out to be around 10 crore. So the burden of the disease is such that 10 crore of the population of India who belong to the age group of 20 till 40, they are suffering from hypertension. And that is bad because hypertension, untreated hypertension in the long term can have a lot of complications. अब बात करते हैं कि ये टॉपिक आज का हमने छुआ ही क्यों है, कि आई मीन व्हाट्स द रीजन फॉर टेकिंग दिस टॉपिक अप. सो आई थिंक आप इन लोगों को पहचानते होंगे. हमारे टॉप पे बपी लहरी है, बीच में सिद्धार्थ है, एंड just recently we lost the great singer KK, and that's why the slide is written in here in all black and reds. And the reason is because why is it so critical to know about hypertension? Mainly because it carries a lot of morbidity and mortality. इन दोनों भारी शब्दों का मतलब ये है कि burden of the disease, अगर आपको डिजीज होता है and if it goes unnoticed or uncared for, it can lead to death. Bappi Lahiri के केस में he had a disease called OSA, obstructive sleep apnea, and OSA के अंदर क्या होता है कि blood pressure keeps on continuously rising, and this can again lead to mortality. The actor Siddharth, he died of heart attack as well. Actor KK died of heart attack as well. And ये तीनों ही बीमारी it can be accentuated या फिर और तीव्रता बढ़ा सकती है इस बीमारी की, hypertension. And इन तीनों बीमारी के अंदर hypertension is the normally seen comorbidity as a disease that exists with that. And ये ऊपर मैंने 3 नाम लिख रखे हैं, नीचे 3 नाम लिख रखे हैं. These are like some of the most common complications of hypertension. One is heart failure. आपका heart का काम है beat करना, and it stops beating, it stops functioning properly. And अगर आपका heart properly function नहीं करेगा, आपके मांसपेशियों के पास required blood नहीं जाएगा, and you will feel weak and fatigued all the day. Then there is a left ventricular hypertrophy. अगर आपकी hypertension बहुत time के लिए last करता है, this hypertension can lead to changes in the morphology or the structure of heart. अगर heart का size ऐसा है, अगर hypertension long time रहेगा, heart का size will increase, and this is bad. Then third लिखा है ischemic stroke. Ischemic stroke होता है like what heart attack is to the heart is what ischemic stroke to the brain. Brain को suddenly it stops receiving the blood of the system, and this leads to a stroke, again very fatal. Fourth is chronic kidney disease. BP का प्रभाव किडनी पे बहुत ही severely पड़ता है, and this is something that we need to avoid. Then we have intracerebral hemorrhage. Again increased blood pressure की वजह से हमारे brain के अंदर जो arteries होती हैं जो कि blood carry करती हैं, they can spontaneously rupture, and then again we can have heart failure. Now let's talk about the definition. So अगर आप कभी if you have gone for a health checkup ever, or you have visited a health camp, you would notice that आपका जो blood pressure rate is recorded in numbers, and you would see 2 numbers, right? Like for example, in the end of the screen here, I have an example, right? 140 by 90 mmHg. So what does that mean? mmHg is like the unit of the pressure the blood pressure that we measure here, and 140 by 90. The 140 here means it stands for systole, and the 90 here it stands for diastole. Now systole means जो blood pressure है आपके arteries के अंदर when the heart is actually contracting, right? And the diastole means the blood pressure जो कि आपके arteries के अंदर है when the heart is relaxed, right? So जाहिर सी बात है, जब heart contract करेगा तो blood pressure आपके arteries में ज्यादा होगा. जब heart relaxed होगा, जब it's not contracting, then आपका blood pressure कम होगा. ठीक है? तो जो ऊपर वाला नंबर है, that is the 140 here, it will be the systole upon 90, which is the diastole. So 140 here is the pressure of the blood in the arteries when the heart is contracting. 140 by 90. 90 here is the pressure of the blood in the arteries when the heart is relaxed, and that is called diastole. अब हम बात करते हैं कट ऑफ वैल्यूज क्या होती है. Okay, Now, cutoff values, it varies from countries to countries. Many experts have different cutoff values, but I'm here sticking to the American College of Cardiology and the American Heart Association because जो हमारे treatment protocols होते हैं, it comes from the American Heart Association. So in this slide, I have the cutoff values, and cutoff values में आप ये देखेंगे कि जो normal value है, normal is a systole which is below 120 mmHg and a diastole which is below 80 mmHg. Okay. Then we have a new term which is called elevated blood pressure. Now, elevated blood pressure does not necessarily mean कि आपको hypertension. Okay. This is like a precautionary word that us doctors use, and this is something अगर blood pressure say 120 से 130 के बीच में आता है, अगर आपकी systolic है, say 126 by 80 आ रहा है आपका blood pressure, then it's my responsibility as a doctor to tell you कि आपका blood pressure it's elevated, and you certainly need to do something about it, because अगर आप नहीं करेंगे, then there is a high chance that it can lead to a diagnosis of hypertension in the near future. Okay, so that is elevated hypertension. Elevated hypertension, अगर elevated अगर आपका blood pressure है, it does not really mean कि हमको आपको एक therapy देनी पड़ेगी, that we'll have to give you a drug. It does not really mean that. It just means that the doctor is going to advise you some lifestyle modifications, following which you're going to see an improvement in your blood pressure. Then hypertension क्या हो? So hypertension की cutoff values is very important, because आज के time पे we can really monitor the blood pressure at the comforts of our home. We can buy a sphygmomanometer, the machine with which you measure your blood pressure. So we have divided the hypertension into two grades. One is grade 1 and the second is grade 2. So grade 1 में क्या है? A systolic pressure of 130 till 130 mmHg and a diastolic pressure of 80 till 80. Okay. So it's maximum value क्या होगी grade 1 की? It's like 139 upon 89 mmHg. If अगर इसके अंदर आपकी value lie कर रही है, then you are certainly hypertensive, and it's a grade 1 hypertension. Then what is grade 2 hypertension? Well, anything above this cutoff value, that is more than 139 in systolic and more than 89 mmHg in diastolic, that is going to be a grade 2 hypertension, and that is certainly going to put you in risk of a lot of diseases. Let's talk about a small classification of hypertension, because I've noticed करेंगे कि if you talk to a lot of people, you're going to find out that some people have hypertension and they have other coexisting diseases as well, and some people have hypertension and उन्होंने दुनिया भर के सारे जांचें करा लिए हैं, सारे लैब टेस्ट हो चुके हैं, but the thing is everything comes out normal except their blood pressure, right? The doctor is not able to determine what is that one thing that is causing the blood pressure in these people. So क्या होता है कि एक डायग्नोसिस, एक क्लासिफिकेशन ऑफ हाइपरटेंशन होती है जिसको हम कहते हैं प्राइमरी हाइपरटेंशन. प्राइमरी हाइपरटेंशन में क्या है कि इस पेशेंट की हम सारे जांचें करा चुके हैं, सारे जांचें नॉर्मल आई है, एक्सेप्ट दैट दिस पेशेंट हैज हाइपरटेंशन. And from years of research, I think we had a cohort size of 50,000 people, and what we noticed in such people was that these people had a strong family history of 70 to 80% of hypertension. Let me take myself as an example. If I belong to that young adult age group and मेरे सारे टेस्ट नॉर्मल है, I have no existing kidney disease, I have no existing heart disease, I have no existing other endocrinal involvements, but मेरा blood pressure continuously अगर large आ रहा है, then the physician is going to suspect that this patient is going to have a family history of hypertension. But the problem is that you will still have to treat this kind of a hypertension. It does not really say that you can leave that. If you have no other abnormality, you still have to treat the hypertension. Secondary hypertension, on the other hand, secondary means that it is secondary to another disease, right? अगर लेके चलते हैं किसी, if a patient has like a very severe kidney disease, and kidney is an important organ which regulates the blood pressure in your body, and anytime the kidney does not receive enough blood, the kidney is going to raise the blood pressure of the body, right? थोड़ा सा complicated लग रहा होगा, but stay with me. If at all there is like any abnormality with the kidney is going to increase the blood pressure of the body, and it is going to lead to hypertension. But in this case, the hypertension was secondary to an abnormality which was in the kidney. Similarly, ऐसे बहुत सारे ग्रंथियां होते हैं आपकी बॉडी के अंदर. One of the ग्रंथि is a gland, okay? So gland is something, gland is an organ which secretes something. कोई juice निकालता है, कोई hormone निकालता है. Okay. So thyroid is a gland. There is a gland called adrenal glands, which is like present on the top of kidneys. So ये दोनों glands इसलिए because they secrete some kind of a hormone. I think you would very well know about what the thyroid gland does. It secretes the thyroid hormone. A lot of women in the childbearing age group after 50 and 60 years of age, they are diagnosed with hypothyroidism, जिसके लिए हम बाहर से thyroid supplement करते हैं. There is a case where thyroid की level बढ़ जाते हैं body के. Okay, it's like the opposite of what you must have seen. In cases के अंदर भी अगर thyroid के level बढ़ जाए, you're going to see an increase in blood pressure. अगेन मैंने एक और ग्रंथ की बात करी थी, एड्रिनल ग्लैंड जो कि किडनीज के ऊपर प्रेजेंट होते हैं. अगर एड्रिनल ग्लैंड जो हार्मोन सेक्रीट करता है, अगर वहां पे कोई ट्यूमर हो जाए या फिर हार्मोन गलती से ज्यादा सेक्रीट हो जाए, इन सब केसेस के अंदर यू विल सी दैट द पेशेंट विल डेवलप हाइपरटेंशन. बट अगेन दिस हाइपरटेंशन इज सेकेंडरी टू सम अदर कंडीशन जो कि आपके बॉडी के अंदर एग्जिस्ट कर रही है. तो ये दो पॉइंट्स एक्चुअली जो which I want to tell you because young adults from the age of 20 till 49, for some diseases, I think COVID was the one that struck us at the moment, and हमने क्या notice किया कि COVID के अंदर a lot many people were advised to take steroids. So a long-term usage of steroids has been seen to increase the blood pressure in people. So अगर कोई, if at all a patient comes to us and we are suspecting that this patient has primary hypertension, one of the things that the physician does is he is going to review all the medications that you're taking at the moment. Okay, अगर मेरे पास एक patient आता है, I have done all the tests, I've seen that there is no other organ involvement, I'm not really able to find what is causing the elevated blood pressure in this patient, then I'm going to ask, are there any medications that you're using at the moment? Okay, and listen on the screen, यहाँ पे screen पे आप दो medicines देखेंगे, एक है steroid and the other is OCPs, the oral contraceptive pills. So oral contraceptive pills, obviously contraception के लिए women use it. Other reason, there are some other diseases like PCOS, PCOD. In cases के अंदर physicians prescribe OCPs. So people who take steroids, people who take OCPs, if on a health camp or in a regular checkup, you notice that you have an elevated blood pressure or high, increase the blood pressure, right? But the thing is, these are reversible causes of hypertension. If you withdraw the steroid use or if you withdraw the use of oral contraceptives, your blood pressure is going to come back to the normal range. Okay, say if like a female who uses, if like a woman who uses OCPs, they are watching the video and you have an elevated blood pressure, what you can do is you can consult your doctor. If you're using it for the contraception, you can consult your gynecologist and they will give you some other modalities through which the contraception can be achieved. Okay. Now, risk factors की बात करते हैं. So risk factors will be divided into modifiable risk factors and non-modifiable risk factors. Okay, modifiable का मतलब क्या है? These risk factors will definitely cause hypertension, but the thing is, the moment you withdraw it, okay, the moment you withdraw it, your blood pressure is going to come down. Okay, so these are modifiable risk factors. So listen on the screen, आपके तीन जो मैंने तीन reasons दिखा रखे हैं. One is the dietary salt intake, आप कितना नमक consume कर रहे हैं per day. Second, obesity. And third, tobacco का consumption through say smoking. इंडिया में most commonly गुटखा, बीटल नट चबाने से. ये सारे के सारे modifiable risk factors हैं. अगर आप dietary salt intake को कम करेंगे, अगर आप obesity को कम करेंगे, फिर obese and you reduce your weight, या फिर अगर आप tobacco consume करते हैं, आप tobacco consumption कम करेंगे, then you're going to see that your blood pressure is going to come down with time. Then there are some non-modifiable factors. The thing is, if you have blood pressure, if you have an increased blood pressure, if you have hypertension, and you like belong to some of these non-modifiable risk factors, the thing is, there is nothing that you can do about it. Okay, we'll have to treat it therapeutically because there is no modifiable risk factor that we can modify. Right? So the first risk factor, I think it's not really risk factor. It is like an epidemiological thing that we saw. We have seen in the public that अगर आपका assigned gender, if the assigned gender is male, then men are more predisposed to in races. So India में we're not really ethnically, we are ethnically diverse, but racially diverse हम नहीं है. we're all brown. So इतनी studies नहीं हुई, racial studies नहीं हुई, ethnic पे study नहीं हुई हमारी कि कितने ethnicities के लोगों को किस type का कितना blood pressure है. But in American studies, American Heart Association कहता है कि that the black population are more predisposed to get an elevated blood pressure than the white population. And third is obviously family history. Now let's talk about risk factors. Okay, so risk factors के अंदर सबसे पहला जो risk factor है, that is salt intake. Okay, so salt intake के अंदर क्या आता है? सबसे पहले कि if you're taking more than 3 grams of salt per day, that is more than 3 to 4 pinches of salt per day, you're going to notice that you are going to have an elevated blood pressure and probably hypertension. Okay. Now the study was done on 20,000 participants, and what we noticed was that with every additional 1 gram of salt that you take, okay, you have already taken the 2 to 4 grams of salt in one day, and with every 1 gram salt that you add, that is 4 grams liye, and then आप 5 gram add कर रहे हैं, then with every gram of salt that is added, an increase of 6.3 mmHg in the systolic blood pressure and an increase of 3.5 mmHg in the diastolic pressure is something that you're going to see. Now let's say, for example, why is it really important? The Indian diet is composed of varieties of spices, and salt is something that we enjoy. Okay, अगर आप butter डालते हैं, butter has salt in it. Processed cheese आप मैगी में use करते हैं, it has salt in it. मैगी के अंदर जो मसाला है, it has salt in it, and then आप अलग से मसाला डालते हैं, it has salt in it. Okay, तो ये आपकी एक मैगी, एक मसाला, उसमें butter and cheese डालने में ही I think more than 3 grams of salt has already been used into that. Now से आप रात को जाते हैं, होटल में खाने के लिए जाते हैं, वहां पे आप शाही पनीर, दाल मखनी या नान मंगवाते हैं. The thing is, hotel is not really concerned about your health, right? They are concerned about whether you like the food or you don't like it. So naturally they're going to have a lot of salt in them. So आपने अगर 4 ग्राम of salt already consume कर लिया था मैगी से, and आप होटल में रात को खाना खा रहे हैं, शाही पनीर और दाल मखनी, and इसके थ्रू आपसे 10 ग्राम of salt additionally consume करते हैं, then you're going to see an increase of 60 mmHg in the systolic blood pressure. Okay, and आपने कभी नोटिस किया हो तो आपको कभी फील भी होता होगा, अगर आप एक हेवी डिनर के बाद आ रहे हैं from a restaurant and you come home, you'll probably feel some amount of you'd be able to feel your own heart beating, and that is called palpitation. Sometimes you're going to have a headache, or you're going to have throbbing eyes, and this is all because of that elevated blood pressure which came as a result of taking increased salt. The second modifiable risk factor is tobacco exposure. Okay, and the thing is, both active and passive tobacco smoking is going to increase the blood pressure, and it is documented. This is evidence based. Okay, अगर आपके घर पे कोई सिगरेट पीता है, if your dad smokes, if your son smokes, and if your sibling smokes, and आप वहाँ पे हैं, अगर आपके हॉस्टल के आपके बैचमेट्स स्मोक कर रहे हैं, then passive tobacco exposure से भी your blood pressure is going to increase. Then the most common risk factor जो कि हम देखते हैं clinical practice के अंदर, and that is obesity. In obesity again, what I was talking about was that with increasing systolic, you see increasing systolic and diastolic blood pressure in all age groups with increasing BMI, and BMI is like a ratio of your height when compared to your weight, and children who are obese or overweight who do not meet the daily exercise goal of 60 minutes of moderate to vigorous activity were more likely to have an elevated blood pressure. So we usually have a games period in school before the morning classes begin. There is like a PT exercise as well, and I think all over that, and probably in the evening as well, children go out to play. So 60 minutes of activity is what the ideal is, and what we found was that children who were achieving a goal of less than 60 minutes of activity, they were going to have an increased systolic and diastolic blood pressure. Now, this is something interesting. I think many people would not know about it. But I think there were two studies. One was done with 7,000 infants, and one was done on 10,000 infants. What these researchers did was they followed a pregnant lady and they followed her till 7.5 years of age. I mean, when the child achieved 7.5 years of age. And what they noticed was the children who were exclusively breastfed for 6 months and who were given the breastfeed for 2 years were they always had a blood pressure which was lower by 1.2 mmHg in the systole and by 0.9 mmHg in the diastole. Okay. I think the absence of the presence of breastfeeding can go both around a modifiable and a non-modifiable risk factor. If the people who are listening to this, if you talk about it, that how important breastfeeding is, how important exclusive breastfeeding is for the first 6 months, then you'll be able to convert this risk factor into a modifiable risk factor. On the other hand, if a lot many people may for some reason may not have received breastfeeding, or because of pure breast milk production may not have received the breastfeed, and sometimes what we notice is that these people develop essential or primary hypertension by the age of 25 or 30. Now, childhood adversity. So the thing is, what we have seen is children who have had uh, some tough situations that they had to deal with. I mean, if there was some like a financial crisis at their home when they were child, or someone died, someone dear to them, they were cheated, or something really bad happened to them, we have seen that often these children, when they grow up, they are going to have an increased blood pressure. Again, this is an observational data, and it has been linked to childhood adverse events. And also, the thing is, these children increase together with an increased blood pressure. These children also tend to have an 40, and they are also predisposed. Now, remember I talked about Papillary and a disease that he had, that is obstructive sleep apnea. And in this disease, what really happens is when you try to breathe in, there is like an obstruction of the air that goes in. Okay, and due to this obstruction, the person is not able to take in oxygen while they are asleep. And when the oxygen does not reach the muscles and all the vital organs in your body, what the kidney does is it increases the blood pressure in the hopes that active blood is restored to multiple organs around your body. But again, this is like a very dangerous disease, and this is something that people need to be aware of. And if someone is diagnosed with OSA or obstructive sleep apnea, that is and one of the precursor and a very common sign and symptom of OSA is that people with OSA, they snore at night. Okay, so if your partner snores at night, if you know a friend who snores at night, I mean, most of the times it's not going to be anything. It's not going to be something dangerous, because snoring happens with if you have like an obstruction in your nose. If you have like a common cold, you're going to snore a bit. But obstructive sleep apnea, again, snoring is something that when you talk to your family physician next time, that is something that you should address in the next visit. Now let's talk about white coat hypertension. This is me on the screen, and you can see the devil's eyes, the devil's horns, and the devil's trident. And what white coat hypertension actually means is, some people, when they come to the office, they they don't really gel up with the vibe that the hospital provides. You have sick people here, sick people there. You have like a small temple where people are crying and praying, and all of this, it just does not give out a good vibe. And this in turn leads to like a bit of anxiety that is like born inside you, and then this in turn leads to an elevated blood pressure. Okay, and the thing is that studies suggest a prevalence as high as 1/3 to 1/2 of children being evaluated for persistently elevated casual blood pressure. Children, they often don't really understand the settings of a hospital, and that's why they're like pervious to be anxious about a visit. And when they're anxious about a visit, and I'm taking their blood pressure, if they see the white coat, or if they see a doctor who's talking to them and they're not really familiar with how to talk in such a strange institution, they're definitely going to have an increased blood pressure. And this study suggests that if 1,000 children show up to a hospital, from 333 to 500 can have an elevated blood pressure. This is nothing but white coat hypertension. This children goes back home, asks mummy, mujhe kurkure dila do, and he eats kurkure and he's all right. But he comes to the hospital. He comes for the hospital visit this next week, and again you're going to see that this child has increased blood pressure. Now let's talk about the signs and symptoms. These are some of the signs and symptoms that you need to be aware of. Frequent headaches. nosebleeds. Now, nosebleeds, it is something really critical. I mean, I think 9 by 10 people who come with nosebleeds to me, they definitely have a increased blood pressure. They have hypertension since years, and it has gone undiagnosed or untreated, okay, or uncared for. So headaches, nosebleeds, continuous fatigue. Now, fatigue is a very not very it's a very common feature, but it is not very specific to hypertension. But then if this fatigue occurs in congruence with headaches, with nosebleeds, with chest pain, then hypertension is something that you should suspect, and you should definitely visit your family physician. Again, these are again some symptoms that are very common with people who have elevated blood pressure or hypertension. This is a feeling of sense of doom. You feel something is sinking in your heart. You feel that something bad is going to happen to you. You don't feel positive. Okay. The second is you are unable to sleep at night. It is very common with people who have hypertension that you find sometimes it's very difficult to sleep at night. Again, I think I've accidentally written fatigue here, but something very common that happens in people who have hypertension is that this blood pressure, it is increased in all the arteries that supply almost all the organs in your body, and one of those organs is the eye. So the arteries inside the eye, they get engorged. I mean, if this is like the circumference, it increases, it gets engorged, and it presses upon the structures of the eyes, and it then leads to reddening of eyes. Okay, reddening of eyes, again a very simple telltale of hypertension. And then finally, palpitation is ghabrahat. You feel that you can actually sense your heart beating. You could hear your heart beating in your ears, you could hear your heart beating in your neck, you could hear like your heart beating, you feel your heart beating in your abdomen or your chest. That is palpitation. Now let's talk about diagnosis. So the thing about diagnosis is, one is that you show up to your family physician, and the second is that probably you have already been diagnosed, and now you have to take care of yourself while you're at home. Now, if you're going to go to your family physician, is definitely going to take the blood pressure measurement there. In the recent times, we have come up with a device called automated ambulatory blood pressure measurement. As the name suggests, it is a device that is ambulatory. You can carry it around like a mobile phone, and it's automated. So it's like fixed. The doctor fixes that this device is going to automatically measure your blood pressure like 12 times a day. And the thing is, after this device is given to the patient, and the patient is asked to wear it for one day and then come back to the clinic, the doctor will again then look at the different readings, and then he will take out the mean. He or she will take out the mean and then diagnose whether the patient has hypertension or not. Then you have like option for screening at camps. And then the thing is, adults should be evaluated at least semi-annually if they have risk factors for hypertension. Okay, every 6 months you have to visit a family physician, or you have to visit like a nursing care where you can get your BP check, especially if you're obese. Now, tips for self-measurement at home. If you are at home, the thing is that you need to be adequately trained about how to take the blood pressure, be it from YouTube videos, be it from the next visit to the nursing room, nursing house, where you can ask to teach you how to take it. Nowadays, it's simple with the electronic devices because it's automatic. You just have to tie the cuff around and press the button. The thing is, you have to take this measurement in a quiet room. And if you have been working around, say you are like a housewife and you are tending to your children, you are watering your plants, and then you all in a hurry without really settling down, you come up and you take the blood pressure again, you're definitely going to see an increase in the blood pressure. So it's really advised that you take at least a 5 to 20 minutes of rest before you take the blood pressure. Blood pressure is supposed to be taken in a seated position with the back at rest, arms supported, and legs uncrossed. Okay. Now the thing is, before a diagnosis of blood pressure is assigned to you, at least 12 to 14 measurements are essential, because one measurement cannot really say for certain that you have hypertension. Because again, we talked about causes like white coat hypertension, wherein you're just anxious to meet a doctor. We talked about increased salt intake. If you went for a dawat and you took lots of salt, you're going to have an elevated blood pressure, but that does not mean that you are suffering from hypertension. Okay. The thing is, okay, some people they are obese, or some people they have increased muscle mass around their biceps. In this case, a larger cuff is required. You'll see that a generic cuff, which like suits a majority of population, is already bundled with the sphygmomanometer or the blood pressure machine. But thing is, if you have big arms and you see that the cuff is not really fitting properly, then you need to obtain a larger cuff, which is sold separately. If you measure a large arm with a small cuff, you're not going to get proper measurements. I'm talking about the laboratory testings. I see patients who get frustrated that once they show up to my clinic and with blood pressure alone, and I've given them the treatment for blood pressure, and then I advise some lab tests to them. They confuse. I mean, doctor, isn't it simple? I have hypertension. You treat it with the medications. Why is the need to get all of these laboratory tests? So the reason is that, as we discussed, initially there is primary hypertension, there is secondary hypertension, and if a person has secondary hypertension, there is like an offending pathology or an offending, there is like an offense inside the body, which is then leading to a secondary hypertension. So it is important that we rule out any cause of secondary hypertension, because if that offending pathology persists in your body, no matter how many antihypertensives I'm giving to you, how many lifestyle modifications I'm advising to you, the blood pressure is not going to come down. Okay, so this is important. That is why doctors would advise a couple of blood tests to you to see whether there are some changes inside the body, whether there are some precursors that may lead to blood pressure. Now let's talk about the treatment. So in the treatment, lifestyle modification stays at top. Okay, lifestyle modification should be prescribed to all patients with elevated blood pressure or hypertension. However, not all patients diagnosed with hypertension require pharmacological therapy. Very important. I mean, sometimes you pay a fees, you come to the doctor's door, and the doctor tells you you do not really need to take medicine for it. This is something that you should be thankful about. This is something that you should be happy about, because you're not required to take medicines. This is, you're at a stage which you're at a stage and you have some risk factors which are reversible. So it is really good that you can get your blood pressure back to normal without really taking medications. And this is usually achieved through some lifestyle modifications. Look at those lifestyle modifications. Okay, so before I jump, strongly suggest that you should, if you have hypertension, if someone known to you has hypertension, they should visit their family physician, and the family physician should prescribe the medication to you. So, talking about non-pharmacological therapies or lifestyle modifications, there are like a few of them that I've enlisted on the screen. You could see dietary salt restriction. You could see weight loss, exercise, a diet rich in potassium, DASH diet, and limited alcohol intake. So I think Nikhil, I can address Nikhil's question in a moment. So weight loss and exercise, what we have seen is that the decline in blood pressure induced by weight loss can also occur in absence of dietary sodium restriction. But if you have practiced a restriction in sodium intake and then you exercise with it, there is like a massive additive anti-hypertensive effect. Okay. Now talking about the parameters, the tathya, sorry. The weight loss induced decline in blood pressure generally ranges from 0.5 mg to 2 mg for every 1 kg of weight loss. Let's take, for example, a person who weighs 100 kgs, obese, has a baseline blood pressure of 160 by 9. If they were able to reduce their weight by say 20 kgs in 2 to 3 months, they will be reducing their blood pressure multiply 20 by 2, it's 40, right? So in 2 months, if they were able to, in 2 to 4 months, if they were able to reduce their weight by 20 kgs, they're going to get their blood pressure back to normal. So that's how critical it is to lose weight and exercise. When talking about exercise, the ideal aerobic exercise, what the American Association of Heart really advises is, you need to have at least 4 sessions every week, which lasts for 40 minutes for a period of 12 weeks. Okay, you don't have to exercise every day, you just have to take out 4 days, and in these 4 days you have to exercise for 40 minutes. And if you were to carry on with this habit for 12 weeks, 3 months, you're definitely going to see that your blood pressure is coming down. Now, the most important is DASH diet, right? The DASH diet, the full form is dietary approach to stop hypertension, and the DASH diet is filled with vegetables, fruits, low-fat dairy. Okay, no, a big no to full cream milk. Probably toad, but if possible, then you need to take double toad. Okay, whole grains, poultry, fish. Poultry fish is okay, but then it's a huge no-no to the red meat. If you take mutton, beef or pork, it's a big no-no. Okay. Then you have nuts. It should be low in sweet. It should be low. It should not contain sugar, sweetened beverages, and wet. Okay. The DASH dietary pattern is consequently rich in potassium, magnesium, calcium, proteins, and fiber, but it is low in saturated fat, total fat, and cholesterol. Alcohol consumption. Okay, we have seen that a decrease in alcohol intake reduces blood pressure in people who drank more than 2 drinks per day. If you drink more than 2 drinks per day, if you reduce it, you're going to see a decrease in your blood pressure. In the study that we conducted, we saw that in patients who consume 6 or more drinks per day, a 50% decrease in alcohol intake. Okay, say for example you take 8 drinks per day, and now you have bottled it down to 4 drinks per day. You're going to see a 5.5 mmHg reduction in the systolic blood pressure and a 4 mmHg reduction in your diastolic blood pressure, and that in turn is huge. Imagine you have reduced your alcohol consumption. Together with that, you have put a salt restriction. This is going to decrease your blood pressure by 10 till 15 mmHg, and that's big. Talking about the DASH diet, as I said, the DASH diet contains vegetables, fruits, whole grains, fat-free or low-fat dairy, fish, poultry, beans, nuts, and vegetable oils. The thing is that you have to absolutely avoid fatty meats, full-fat dairy, sugar-sweetened beverages, sweets, and then you have to decrease your sodium intake as well. Talking about potassium in diet, okay. So what we have seen is if you have a low amount of potassium in your diet, it increases your blood pressure. Okay, the cutoff value is if you have less than 40 milliequivalents per day or 1.5 grams per day, we see that this patient will have an elevated blood pressure. Potassium restriction from a normal intake of 80 to 90 down to 10 to 18 leads to an increase of 4 to 5 mmHg of blood pressure. Okay, if you have a low potassium diet, you are going to see that your blood pressure will increase by 4 to 5 mmHg. If you take adequate potassium, okay, I'm going to discuss some dietary sources of potassium in the next slide. But if you take adequate potassium in your diet, you're going to see that your systolic blood pressure is going to decrease by 5 mmHg. Okay, potassium restriction from a normal intake of 8. Okay, this is I want to discuss. So it is important that you take a potassium rich diet, but it comes with a caution. Now I'll ask you to take a screenshot of this slide, because this data is taken from the National Institute of Nutrition based in Hyderabad in India. And what they did was they took out a number of grains, fruits, and vegetables, and they measured the potassium content in it. Since we came to know that an increased potassium intake is going to decrease the blood pressure, we have come out with natural sources of potassium. Okay, if you were to take say some Mossambi drinks, if you regularly eat moong dal, arhar dal, chana dal, moong dal, and if you take vegetables like sweet potato, drumsticks, coriander leaves, palak, bangan, karela, and then if you eat fruits like kharbuja, mausambi, nimbu, chiku, amla, all of these fruits, vegetables, and grains, they have a high amount of potassium, and they certainly help in decreasing the blood pressure. Now there is a big caution. Okay, sometimes people, they get overwhelmed that taking potassium can decrease their blood pressure, but there is a big caution here. I would strictly advise you to first consult your family physician to see whether you are at a risk for developing hyperkalemia. Hyperkalemia means an increased potassium. Okay, when the COVID wave struck, I remember that a lot of forwards were sent in WhatsApp that you need to take, take say 1 tablet, 2 tablet, take 5 tablets of vitamin C, and you're going to have like a boosted immunity. Okay, but that's cartoonish. That does not really happen in real life. Okay, if you take more than the daily recommended allowance of a specific vitamin, you're going to have a toxicity of vitamin that is not good for your body. Okay, so it's important that you check you check with your family physician first. Are you at a risk of developing hyperkalemia or increased potassium? Usually, you will see that patients who have a chronic kidney disease, they are at a higher risk of developing, hyperkalemia. But usually, it is recommended that you take an advice from a family physician before shifting to a high potassium diet. So that will be all. I'm really sorry because of all the all the problems that we face in between, and I hope this session would have helped you in understanding how to diagnose hypertension, what are like the signs and symptoms, why is it really important, and most importantly most important of all, what we discussed in the last previous few slides was that how to really prevent hypertension through lifestyle modifications. To sum those up, what I really wrote was that you have to practice a salt restrictive diet, right? You'll have to take sodium salt. You have to keep a check on the salt diet. You have to see that it does not exceed 3 grams per day. If possible, you have to exercise. If possible, you have to reduce weight, and the exercise, you don't have to exercise every day. You just have to exercise four days in a week, and this exercise session should last for 40 minutes each. As we saw, that DASH diet is something, that is dietary approach to stop hypertension, is very important. And a DASH diet, in the DASH diet, you're going to take high fiber, high protein, high minerals, but it's going to be low on fat, and it's going to be low on red meat. Okay, then we saw that there are some ways that you can increase the potassium in your body, and increased potassium leads to a decreased blood pressure. But a big caution here is that you have to first check with your family physician whether you are at risk of developing hyperkalemia or increased blood pressure. So before submitting, I see a question I can see a question here.
Yes.
Marvel says, if someone is taking antihypertensive medicines and their blood pressure becomes normal, should they continue taking the medicine? First of all, thank you for asking that question, and that is extremely critical. So the thing is, say, let me take myself for an example. And I was diagnosed with hypertension. I had a base blood pressure of 140/90. My doctor prescribed me a medication, and he asked me to take it for 2 months. Okay, and he also asked me to buy a sphygmomanometer, that is a blood pressure measuring machine. And to see and to record my blood pressure in timely intervals, say 4 times a day. In this case, समझिए मैंने एक हफ्ता ये दवाई खाई, एक हफ्ता दवाई खाने के बाद मेरा ब्लड प्रेशर क्या है, 110/70 आ रहा है. Okay, guy who used to get 140/90, उसको finally अगर 110/70 आ रहा है, I'm going to get this dilemma: or should I finally stop taking the blood pressure medication? And in a lot many cases, people do stop taking the blood pressure medication. But the thing is, that blood pressure came down because you took the medicine. Okay, if you stop taking the medicine, the blood pressure is going to come back. And the thing is, the urban lifestyle is such that you don't really have the time and the energy. Once you see, okay, the blood pressure has come back to normal, you're not really going to regularly monitor your blood pressure again. You stop it, and then after 1 or 2 years, you have this throbbing headache, you have palpitations, and then you go and you see the blood pressure has again returned to 160/90. Okay, so it is critical that you do not stop taking the blood pressure medications even after your blood pressure has come back to normal. You have to visit your family physician first. You have to take the consultation whether it is all right to stop the medications. Does that answer your question, Mom? Okay, Tuhin has a question. I recently did get my blood pressure checked, and it's gone till 135/90. Is it a working situation? Also, do I need to regularly monitor it? Tuhin, can you give me a little bit of your age and what kind of a job do you really do? So the thing is that 135/90 certainly falls in the grade 1 to grade 2 of blood pressure. But the thing is that I've already addressed this in the webinar, that one reading of elevated blood pressure does not give you a diagnosis of hypertension. It is very important. So the second part of your question also, do I need to regularly monitor it? I mean, if you have a sphygmomanometer at your home, it is critical that you do monitor it. Okay, A diagnosis of hypertension will be assigned to a patient if they have taken at least 12 to 14 readings in a day. And then the family physician takes a mean value of those 12 to 14 readings.
I would really like to thank you, Dr. Fleming, for taking out the time from your busy schedule and, briefing us and letting us know about this important problem that many of our family members, our colleagues, friends face. So really thank you for participating in this webinar and taking time out of your busy schedule. The entire presentation was extremely informative, and we really hope to use the things that you've told us to take care of to control hypertension.
Sure, that's great, that's great. And thanks a lot for your time, and I want to beg your pardon again for the constant intrusion. I hope that I was still able to get the information through.
Right. Thank you so much.